Hello there. My name is Dr. Shane Stanley, and I am the owner and founder of the Novi Spinal Care Institute in Novi, Michigan. I have been in practice now approximately 10 years, and I've been fortunate enough to serve the community here in Novi for the last 8 years. I'm here today to talk to you about an amazing new procedure that has given new hope to back pain sufferers in Michigan and, quite frankly, around the world. Best of all, this new procedure is non-surgical, it's non-invasive, it's painless, and it's very, very effective. So if you're suffering from severe back or neck pain, and you're sitting at home right now, and you've been diagnosed with a disc herniation, a disc bulge, degenerative disc disease, spinal stenosis, facet syndrome, failed surgery, or a relapse from a surgery, I want you to listen very closely to this brief 5-minute explanation of non-surgical spinal decompression, because it very easily could be the answer that you and your family and friends have been looking for and deserved. Now, in order for you to understand what we do here with spinal decompression, the first thing I need to do is teach you some real simple anatomy of the disc in the spine. And to do that, we're going to use a model here to illustrate our point. Now, in this model, you can see what we have is two spinal bones, and in between each bone there's a disc. Now, real simple anatomy, this is all the anatomy you really need to learn here, is that the disc is composed of two pieces. And I'm going to flip this sideways here, and we're going to look at them. It has an outer piece and an inner piece. We'll bring it close. See those two pieces? There's the outer piece called the annulus, and here's the inner piece called the nucleus pulsus. Now, what can happen over time to these discs is they can become thin. And I'm sure many of you at home have heard of a phrase called a degenerative disc or degenerative disc disease. What happens over time, those discs actually lose a lot of water, and that's how they start to dehydrate. They become desiccated or degenerated. Now, notice in this model here how nice and thick the disc is. That's an example of a very healthy spine. Now I'm going to show you what a dehydrated disc or a degenerative disc looks like in this other model right here. Now, if you look here, notice the difference in the thickness and how thin it is. Okay? What happens when a disc becomes degenerated and dehydrated, it becomes weak. And when it becomes weak, it's more susceptible being injured to stresses that we apply to it on a daily basis. Now, when those stresses take place, if the disc is put in a uncompromising position, the inner piece of the disc will actually leak through the outer piece. That's a good example of what a disc herniation or a disc bulge is. And to illustrate that point, we're going to show you here on this model. You can see that. If you notice here how this piece is actually coming out of the disc right here, that's a good example of what a disc herniation or a disc bulge would be. I think we cut out right there. Now, what we do here with decompression, we're really attempting to do two things. The first thing we want to do is we want to take this disc that's been compressed over time, and we want to decompress it. We want to take that disc and we want to open it up. So basically what happens is you take that disc and you're basically going to create a pump. Think of an accordion. How an accordion goes in and out. You're basically going to create a pump that helps to bring nutrients and fluids back into this disc. And the next thing you're going to do, what decompression does, and this is why it's cleared by the FDA, part of the reason, is that during the treatment, what decompression does, it creates a negative pressure within the disc. Now, some of you may not understand what that term means, but again, I'm going to use a very simple point here to illustrate to you what a negative pressure is and why it's so important in the disc. A good example of a negative pressure. If I take a ketchup bottle, if I squeeze that bottle, as the bottle expands, anything in the rim gets sucked back in. So what spinal decompression is doing, it's taking the disc that's out and it's creating a negative pressure that takes that disc that's pressing up against that nerve and sucks it back into its neutral position, to its natural position, therefore taking pressure off the nerve. Now, over my time here, I've been doing this procedure now for over 5 years. And over that time, I've had conditions like I mentioned here in the beginning of this brief explanation. I've had people who have disc herniations, disc bulges, degenerative disc disease. Some of those symptoms, how they translate into your body, you may have right now at home. You can have, if you have a disc herniation in your neck, you could have pain going down your arm, into your fingers. You could have numbness in your hands, burning. How about people who have sciatic pain, the disc herniation in the back that goes down the leg? Sometimes it stops at the knee, sometimes it goes all the way into your foot. You could have numbness going down your leg. So what we do here with spinal decompression is we want to try to rehydrate the disc. When that decompression table starts to pull that spine apart, it creates a pump that helps to bring nutrients and fluids back into the disc. And again, it takes that disc that's out, it creates a negative pressure and helps to retract that disc material back into its normal position. And the results I have seen here over the last 5 years have been absolutely amazing. I encourage you to scroll into the computer. You'll see on my website here, there's testimonials. We have countless of those. And I also want to encourage you right now to pick up the phone, sign up for a consultation with us right now so we can meet face to face, and I can sit down with you and I can determine, A, if you're a candidate for decompression. I'd like to look over any MRIs you have, any x-rays, do a real thorough examination on you, and I'll be able to let you know if you qualify for this amazing new technology. I want to thank you very much for your time, and we look forward to meeting you in the office.